All right, and let's bring everyone in.
Good morning. Like all of us, hopefully we have to share, at least in Northern California, we're starting to see the clouds part and some sun. I hope it's making its way down to Southern California. Lori, I think you're probably snowbound.
Yes, we are. Foot and a half last night.
Wow.
That's great.
That was quite a storm.
It sure was.
Uh, all right. It looks like we have quorum for sure. Welcome to Connecting for Better Health. We're really excited. We have quite a milestone to celebrate today, and we will get to that very quickly. But we have been incubating the DXF Sandbox, and many of you have heard about it or have known that we were onto something, and we are going to walk through with what we've been able to accomplish so far. And we really welcome your input as we continue to build it, because we are just at the very beginning stages of launching it. So put your thinking cap on. We'll have plenty of time after today's introduction to be able to follow up. Also, if you can go to the next slide, our agenda, in addition to our sandbox work, we are also going to walk through March 7th, which is coming up so quickly, of our Connecting for Better Health Capital Day, also another reason to celebrate. We've said for the last 2 years we were going to do it, and this year we said, by gosh, we're going to do it. So I'm so proud of the team for pulling us off, and for all of you to volunteer today, because we'll need to know whether or not you can make it, to be able to make sure that we are scheduling all of the necessary meetings for that day. So look at your calendar now, see if you're available, and engage in the discussion as we relay what the agenda will be for that day. We're going to go through many state updates. We are in legislative season. Now we know what that is over the last 3 years. So we will walk through what we're following today, and again, welcome your input on what you think might be on the horizon. And then we've got some technical, we need to relay some technical work that's been done with CDII lately. Make sure you're aware of that work. And we'll finally close with news, events, and announcements. As always, I would love for you to be able to use the chat. If you could please introduce yourself in the chat and make use of this network that we have here. It's incredibly powerful. And also, I welcome you to have offline meetings as well. Use this as a networking tool. And also, if you could put in any announcements that you would like to either include and let everybody know here about, and or Olivia and Stephanie, if you would like us to include it in our roundup or for future agenda and programming, use the chat. We always look at it. So Coalition, our vision, every Californian and their care teams have the information they need in order to make seamless, high quality, and affordable care decisions. Our policy priorities that we together were able to highlight, that is guiding our work and our programming of the year, is to continue the data sharing agreement, as well as the DXF education and implementation. We're also continually seeking funding and making sure that the funding that is available is linked to data sharing. We are relentless in our quest to ensure that California keeps social services on the same level of clinical services, and I think that really differentiates us in the country. And that's the work that we're doing to make sure that we always keep that line of sight. And then finally, we know we've got a lot of work to do in order to not only go live with the DXF, which we should all celebrate that we are on the other side of January 31st, but also make sure that we have the necessary governance, enforcement, and I always highlight that keyword accountability. What do we as a coalition have in our toolbox to be able to keep each other accountable, that we are meeting the needs of the data exchange framework? So that is also something that we are always looking at and will be sharing with you. Okay, so let's get to the sandbox. So if we go to next slide. As I introduce this work, it really coincides with Connecting for Better Health, changing or I guess formalizing our work as a nonprofit last year. And as we developed the nonprofit approach, it was really clear to me that we have an opportunity to be able to launch services and technical assistance and other key pieces that we could actually charge for and help to be like foundational to our work, so that we are not just reliant on grant dollars, but we can actually offer a service that will help with our sustainability going forward. And then putting two and two together, we looked at all of this work that's being done at the policy level and the conversations and the decisions that were being made that had some policy experts and some technical experts. But if you can see, I'm so glad we are not just on phone, that you see my video. It really became clear that a lot of the policy discussions and decisions were up here, and on the ground technology was here, and the gap in between was pretty wide. And how we thought about closing that gap is through a real world test environment. And I will also say, to make this introduction, because I think it makes it really real, is I've spent at least the last 5 years, let's say 10 years, probably more, where I've worked with organizations and competitors and technology providers, where we've looked across the table and said, you both need to play in the same sandbox together. And that is where we really came up with this idea and the construct of having a statewide data exchange framework sandbox. So it's not a sandbox for us to have, and we've all kind of been, I think, part of sandboxes and hackathons, that it allows you to kind of think about what's next and the innovation that goes on. That clearly is an objective, but we're doing this so that we can accelerate the adoption of the data sharing framework, data exchange framework. And we're doing it so that we can ground organizations as they decide to hop in to this amazing ability for us to share information, to have the ability to kind of test and tinker and figure it out with their partners prior to making some decisions that they might have to do with, large investments. And or after they've made the investments, how do they make it better? How do they really ensure that this housing piece of data that starts here is getting and going through all the hops that it needs to get to the final destination? So with that introduction, I want to hand it off to Evelyn Gallego, who is with EMI Advisors. You may know them through their work with the Gravity Project, but as we were incubating this idea, several leaders came to me and said, you need to give Evelyn a call because she and her team would be a perfect partner to help you stand this up. And in fact, they're in a perfect team. They've been able to really help us bring a solid methodology to the co-adopter or the co-design team, the early adopters that we've been able to gather together to be able to get us to this point where we've been able to launch our MVP, our minimal viable product. So Evelyn has a presentation or some how we've got here, what we're doing, but I hope that gives you all context of why we're so passionate about this work and so excited to be able to bring it to the state. So Evelyn, I'll hand it off to you.
Thank you so much, Timmy. And, again, kudos to you. The fact that you envisioned this and work so steadily with multi-stakeholder groups on really thinking through what is the problem to solve. And for us, it's been a delight and an honor to be able to support this work. And especially, again, to your point about being very policy, I've spent a lot of time at the policy, and for those that are familiar with the Gravity Project, I've made a conscious decision to step down from it over a year ago for this reason, for that I felt like there was a significant gap in the field about being able to translate policy requirements and data standards into real world implementation. And so getting the call from Timmy was a dream come true to try to address and solve this problem in California. So I'm super excited to be here with you all today and just give you a sense of what we've been working on collectively with the co-design team and where the sandbox is. Thank you, Jim. All right, so move on to the next slide. I think it's an yep, next slide. So our team overall, so, of course, working Timmy and delighted to have Toria Thompson join us recently and being able to support moving forward with the implementation of the sandbox. I partnered with Chris Haig, who is the technical solutions architect for it, and Karen, who is our director of digital health, but she's been serving as the product manager. And I've primarily been on the use case. So being able to blend it together for having where we are, building the sandbox to where it is today. So next slide. Next slide. All right, so what do we mean by a DXF sandbox? So by definition, and as Timmy alluded to, it's a real world testing environment, right? So it is very much driven to support the DSA signatories in identifying, testing, and validating data exchange implementation strategies. So it's something you can use right away as you're planning, designing, and adjusting your current workflows to meet DXF requirements. Sandboxes are not new. Again, they've been used often, but now we're using it in the context of meeting the DXF requirements. And we're learning along the way. So as we go through today is just thinking through of how initially we envisioned it, and we are still evolving it. And I loved Timmy's initial analogy around, right, we have a North Star, we know what this needs to support, but how we get there is very dependent on all these different participants and actors coming together and letting us know what's working and not working, and what can we collectively do together to solve the problems we know are inherent in data interoperability right now. Next slide. So the scope of the sandbox, as listed here, was to initially, as part of any sandbox, is defining the use cases, those high priority use cases to address the data sharing needs across the multi-stakeholder groups, beginning with acute care, ambulatory, social care, and public health. We also wanted it to demonstrate how all these multidisciplinary partners can collaborate. It can be done, keeping the person at the center and share only the data that is needed and authorized, right? Because we also want to be, keep privacy and security in mind, but also share what is of most value, not sharing for sharing's sake. We create shared resources, including test data, use cases, and implementation guidance. So it's there available for anyone that is collecting and using data in California. Electronic health information and social care data. We want to satisfy near real-time data exchange. We want to provide guidance on approaches to accessing longitudinal health data records for the person or the patient, the caregiver, provider, and payer. So again, we have multiple places we can find information. How can we bring it all together so we have one view and be able to track the individual as they transition from setting to setting. And of course, we want to incorporate preventative and care transition alert management. So thinking this through and demonstrating is the overall purpose of the sandbox. Next slide. So the value proposition for the sandbox, right? So primarily it is to help entities, organizations plan and design and adjust workflows, right? We know, and we are hearing this right now, the workflows still need more work, right? We policy, the data standards, the workflows, we just don't, what's the best practice, right? So this is a place to do it. So first, we will, the value proposition, it will accelerate adoption of the data exchange framework, right? So it's a virtual on-ramp, allows all these different organizations and the systems they use to participate in testing, right? That looks like what they would do anyway, as and anytime there's any deployment or implementation, you have a testing phase, right? You want to validate information before you go live or pull the switch, right? We want to produce shared assets, as I mentioned previously. You know, and you learn from each other, right? And again, from a lot of the work that we do at EMI, we work at a national level, and we know how states and organizations love to hear from others, right? But they don't have the bandwidth or capacity or time or know where to go. So these will be assets that will be available for all of those in California. And identify gaps in technology and policy. So this is where, as we're testing, we can learn and have what I call the continuous learning loop or learning system, where we can see what's happening in the real world and then share it at the policy level. And, you know, not only within California, but it's also an opportunity to share back. You know, I know we're trying to, you know, Timmy's done a great job and is looking, how can we have lessons learned in California, sharing it with other states and with the, you know, the policymakers, ONC and CMS and CDC as well. So it's a great place to be able to learn. And I know there's a lot of interest in what California is doing. Next slide. So our approach, not to read through all of this, so just in summary, we brought together, you know, EMI partnered with the Connecting for Better Health team to stand up this co-design group, right? So we invited more from a technical perspective, weekly meetings, and we started 13 weeks ago, where we worked with everyone. And again, this is a lesson learned from our work on the Gravity project and other data standards initiatives or data integration or interoperability work, where you have to bring everyone to the table and they have to collectively co-design with you, right? Or else you're not going to get buy-in, or else it's going to look like it's a top-down approach, which we all know doesn't get immediate buy-in. And so that's what we've been doing. We brought together, beginning with the QHIOs, invited them all to the table, and the next slide will show who's participating, and then also other important participants, right? So really looking again at the broad landscape, and we're adding and inviting more. So the primary scope of the sandbox was to identify 3 priority use cases that we could go live with in early February, and we did. So we'll go through what those are. It was a very aggressive timeline, but we got it done. We co-designed, again, working with all the participants on a person story, personas, and use cases to support the priority data exchange use cases, and identify business, functional, and technical requirements for the sandbox. So it wasn't just creating the use cases and moving on. It was saying, what are the capabilities and functionality of the sandbox? So it's of value to you, right? So we'll talk through what that was included. Next slide. Here's our co-design team. So thank you to all. And again, this keeps growing. Initially, as I mentioned, there were early adopters that came in, and we're very grateful for all their support from the start. And it was helpful for us from an EMI coming in that Timmy and her team had done great work being able to have initial requirements in place. So we were able to build off that. And then, you know, we've had amazing participation from the several of the QHIOs already, and other invitees as listed here. And we welcome more. So this is really, again, it's a tool or a platform that's available for all of you to use. Next slide. So our timeline. So before we came on, you know, as I mentioned, Timmy and her team had done a lot of work in last year, early fall. I'm really identifying, you know, bringing the right stakeholders, these early adopters, helping disseminate, you know, the vision for this. And then we came in November and sort of mapped it out. You know, what should this look like? Given the requirements or in the vision, the North Star, what does this need to look like? With the constraint that you had to go live, you know, DXF was live end of January, right? So we worked backwards, and we said, let's think through of the use cases, gather the use cases are really around defining the requirements needed for the data exchange, then working on the sandbox, design of the sandbox and the architecture of it. And we were able to test, where we've had successful tests so far. We launched last week, right? So we had a successful go live, and we're continuing to launch for the month of February. And then the goal is to continue to iterate, and I'll talk through the next phases, developing new use cases, testing them, and reiterating. Next slide. Okay, so also for those that have worked with me or heard me before in other initiatives, I'm very much about not reinventing the wheel. So part of it is also, there's been a lot of work in California since the start of the DXF on really what are those primary use cases, or what are those problems that the state collectively needs to solve, right? So I didn't want to come in and work with our co-design team on starting from scratch again, right? So this was really where we did our homework and said, you know, there's been already some small groups, right? There's been focus groups, the state has invested. Let's get to see what, you know, what have they learned? What are the problems or key areas, or I'd say key opportunities to support data exchange? So we started with the HHS data exchange scenarios. The link is there at the bottom. CDII supported this, and they identified six I would say I call them scenarios, right? So and they were very much specific to populations and entities. So as listed here, and they're all written up, they're very robust scenarios with personas that CDII worked on initially. And then if we move on to the next slide. Then CalAIM had use cases, right? So we looked at the CalAIM, the link is there. They had been working on looking at across what was needed to support the Medicaid program. And we thought, yeah, this is something we need to build on. So having these overarching, I'd say, you know, guidance or what had already been done in the state. And as I look through them, again, I'm working as I think of use cases as transactions. I'm like, there's a common theme. And then working with the co-design team, then we came back with three. After several iterations, we came back with 3 use cases. So if we go to the next slide. And I'll go through. So high level architecture, before diving in, this is really this again was a guiding light for us as we thought through what the sandbox needed to support and how it needed to integrate with different external systems. And ultimately, and always, and the state was also very clear, it's keeping the person at the center, right? Why is California doing this? They want to be able to facilitate information about a person or an individual as they're receiving care and services, that it's being able to follow them throughout. And how can this overall architecture, the sandbox, be designed to support that level of exchange? So here was, you know, again, thinking through that with that social lens now, right? So it's not only the health systems, you have a lot of health information exchange that has been happening for many years within California, but now you have a new actor, right? And there's pockets of it, but it's not done consistently. So this is us also thinking, keeping the person at the center, but now bringing in these community providers, right? That have not you know, traditionally, and still, even with the policies in place, they don't actively connect, right? A lot of work is happening right now to be able. So the services listed there on the left-hand side, the sandbox needs to be able to support the community provider in identifying the individual, right? The digital identity piece and consenting, being able to capture that consent and track it, right? The sandbox can provide analytics and metrics around the data collected and exchanged, offer open APIs for connectivity, support via community apps, right? So many of these community providers will never or have a need to adopt an electronic health record, right? But they are still need to be able to respond to a referral. So how do we support that? And platform services, of course, the cloud-based, which the sandbox is based on an AWS cloud. And going through the external systems, there's many, right? So all these systems and the actors need to play in the sandbox. So they're just listed there. So it's not only it's not only the HIEs or the EHRs or the national networks. We also have, you know, emerging community information exchanges, community care hubs, for those not familiar, are emerging across the country. So how do we support that? Next slide. All right, so we started with use cases. We followed a use case approach, again, that's very much, builds off human-centered design, how we bring in and we develop personas. We identify preconditions and post-conditions and assumptions regarding to the transactions. We have actors and roles. So again, going through, there were a series of steps, and this is how we designed and developed the use cases, right? So it was something that allowed each participant to be engaged every step of the way and help us validate. So we didn't go and just create use cases and start from, we built on it. Next slide. So person story components. As I look through, our team looked through the existing use cases and scenarios that had been identified by CDII and for CalAIM. We had, we thought through how can we be able to reflect those immediate needs, and we came up with 3 use cases. So as I go through the 3 use cases, it was very much driven around, let's primarily look at the main problem to solve right now. And before we even get to sharing social screening data or even talk about social referrals, we also have a challenge at the state that we're not consistent on how we exchange event notifications, right? So, and how do we query for additional information to inform that discharge, right? So that was very much driven why ours these are the primary use cases and the personas listed here. And we went through and created persona, that had both chronic conditions and social needs. And the story is around Estella, the patient who has a fall at home and is admitted into the emergency department and is discharged that same day. And as part of her discharge is referred to home health services. Could be referred to as skilled nursing facility, but we kept it really simple. So that's why you see a home health agency. And then the last, and throughout those steps, both their primary care physician and the managed care plan and administrator is notified, right? So we had to develop use cases to tell that story. What are those nodes of exchange? The settings, Estella, you have the fall at home, and then you have the hospital, right? And then the return back to home, and then the activities. So as activities listed there, we primarily focus on admission, discharge, transition of care, screening, diagnosis, planning, and treatment. Okay, next slide. I'll pause, sorry. We'll stop for questions. So here's the use cases, very simple. We needed to bring, again, building off the other use cases that all talk through this at a high level, but went into deeper. We just said, let's just demonstrate the sandbox can support event notification and discharge planning. And we broke it up into 4 transactions, right? And these are the technical transactions listed there, the ability to send an ADT, send ADT alert or data, query for data that exists outside of the ED system, and request for, so this is a query response, right? To be able to query and then request and pull data and display it. The second use case is post-acute referral. So this is the referral for the discharge for home health, but referring them for home health services. And this incorporates a service request and request completion. And by the way, all of these align to the DXF policy and procedures, OPP 8 and OPP 9, that are very specific on the transaction. So these align to those. And then the last one, the more robust, is a longitudinal health record generation. And this is where, you have similar transactions, but in the end, it's the ability, and we do not say aggregate because that's not required, but the ability to consolidate or bring together multiple encounter data for one view over a period of time. And this is not claims data. This is all encounter data, and being able to demonstrate that through those transactions. Very simple. And if we get these incrementally, we show progress, and then we can build off these. Next slide. So the use case actors, as we walk through these, we broke them up into human actors. So the human actors are the personas I presented in the previous slide. The business actors, so these are the organizations, they set the rules, right? So these entities need to be, whether are they looking, they also play roles, right? So here's how we broke it up. And then you have the system actors. And we were informed we needed to, when we look at the system actors, they're on the right-hand side. Very specific, emergency department EHR. Initially, I had hospital EHR, and I learned really quickly they're not always the same system. So that's why it's a very specific emergency department EHR, QHIO network, national network. We're also, incorporating being able to. We know that there's a query out to the QHIO, but they may need to query a national network for additional information. Also, as well as we look at the third use case, and then you have the provider, the home health, and the managed care plan systems. Next slide. Okay, so what does the first use case look like? This is where we are now, finalizing these. This just look at a very high level. They're very simple transactions, but even that, we're learning a lot because not everyone does these steps the same way, right? So the first scene, and we used a scenario and scene approach where they all incrementally build from each other. And as if you're in a play, you're like scene 1, and that's how we've been testing, right? And it's like before you don't move on to scene 1B until you finish 1A, right? So here, very simple, the emergent Estella is our persona. She falls, is admitted. Samir is the one that admits her into the hospital and wants to be able to update does use their EHR to update that an admission has occurred and notifies, right? So these transactions are around really the overall ADT to the QHIO, the QHIO ingesting that and being able through their mechanism, their agreements, and how subscriptions are done. So we go into that detail. They notify the PCP and the MCP. The second is when they are admitted and they're looking at what additional information to treat. So this is not the discharge, right? So this is the ability to treat Estella when she is first admitted. Is there any other information? Is she on medication, right? So these are things so this is the first query from the ED system to the QHIO and query response. Is there any other information? Can you tell me about Estella as she's just that I should know before I do any further diagnosis on her and develop a treatment plan. And then the last scene is really when you're the discharge planning, right? And this is an opportunity. And for us in our use case, we say, since Estella has both chronic conditions, and she's a diabetic, but she also has social needs. She's food insecure and is housing unstable. Is there other information? Sava is the persona that, so Sava queries through their system for additional information to inform the discharge plan. And this is an example where, for example, was Estella screened already? Is there screening for her for social needs? Does it exist anywhere that I can have access to? Or is there a care plan for her diabetes treatment, right? That I can integrate and use in my referral and in my discharge plan and the referral to home health. So very simple. Next slide.
And Evelyn, I just want to make sure we're on time right now too, so we might want to.
Yep. Okay. So
there we go.
This is it. So here's a 3-stage process of the sandbox. And I'm not going to, these are things where it's a discovery, testing, validation. And I've talked about these points already. Next slide. Here's our suite of capabilities within the sandbox. So it's not only to test. Right now, we're mainly using it to test and facilitate community sessions, but it's also, having SMEs available. We're going to establish a code design, having separate code design groups serves a policy analysis and also being able to connect with other providers. Next slide. Key considerations, these are, again, timeliness comes up all the time, connectivity. So these are things that we have been looking at and continue to revamp based on the community. Next slide. Okay, and last I will leave with it's just a plug that this is the next phase of work. So again, Timmy, kudos to Timmy with her vision that, you know, we are not stopping here. The sandbox is really then the next phase as we think through bringing in a community providers. And we had said, you know, these are lessons learned from other implementations. You have to bring everyone who has experience with this in further developing the use cases. So just to plug in that we will be creating a community design studio to look at new use cases and bring in the more additional stakeholders. So this will not be a technical group. It will really help us refine what are the new use cases that need to be developed and then sent to the sandbox for testing. So I'll stop there. I think that's the last slide. Yep. And there was a lot of questions. Okay.
I didn't see many questions per se, but I will address that, yes, EMS should be considered as one of the actors and would be a great candidate to go in through our design studio as one of the first pilots. We are looking for organizations who would like to be our MVP for the design studio as we roll that out. We're building both the sandbox MVP, the testing environment, but then we are also launching the design studio in March, and we'll go through a couple cycles like we did for the sandbox so that we can test our methodology and have this ability for organizations and their partners to come in, go through a sprint to develop their own use cases or take one of our already developed use cases and customize it. And then what's so great about this is that we can then create synthetic data to be able to match that. You can take your own use case and go with your partners and test, or you can come into our sandbox. So that's where it all kind of comes together. And thank you for being on this journey with us. Any other questions? Oh, we got more. Okay. Any other questions? All right, thank you.
Sorry,
yes,
if I may,
Jonathan.
Hi, Timmy. I don't know if now is the time, but Jonathan mentioned he's got a lot of questions. If we're here to get this stuff done, let's do it. I don't know if you want to do it now or do it later, but
let's take it offline right now because we do have quite a bit more in our agenda and we only have our hour together. But I would love to be able to follow up with you and walk through how we can plug the work that you're doing into the work that we're doing.
Sure. Thanks.
Okay. So I want to leave this here. This is a great announcement, but as you see, we're designing it as we're building it as we're flying it. And we're so eager to let everybody know and all the great work that's been done behind the scenes. And I see so many partners that are on today's call and you were given that shout out, but we couldn't have done it without you. So thank you. Thank you for being here with us. Can't wait to see where and how we can continue to update you all on the work that we're doing and the learning that's going to happen and how we can contribute back to policy development, technology development, and just getting ahead of this work so that we can make it really seamless for all those organizations wanting to jump in. Thank you, Evelyn. Thank you for your team. And we're here for you. So please contact us and let's get some meetings on the books to be able to answer your questions. Let's go to the Capitol Day. Stephanie and Olivia, let me hand it off to you.
Thanks, Timmy, and thanks so much, Evelyn, for joining us. We can go to the next slide. As Timmy mentioned, we are hard at work planning our March 7th Capitol Day and really excited, looking forward to having you all join us. Our goals for the day, first, to really educate legislative staff and other stakeholders in Sacramento about the DXF. We had some really great conversations in Sacramento at the ITOP conference earlier this week. But it also, continues to be clear that lots of folks who are really well engaged on CalAIM, on healthcare affordability, on all sorts of other state initiatives, really still have major questions about what the DXF is or don't even know about it at all. So really excited to build that education effort in person on the 7th. We'll highlight the state's substantial investments and also continue to build momentum and support for what further DXF related policy might look like. In terms of what the day will look like, I know Olivia added in our registration form to the chat. I'll do that again because as Timmy mentioned, it's really important for us to know who is interested in joining us in person. From 12 to 1, we have room 126, one of the hearing rooms in the old building, booked for a DXF policy briefing. Every Senate and Assembly office will get invited to join us, and we're putting together a really great educational session. We have a group of providers and advocates joining to share stories about data sharing and an overview about what the DXF means during that hour session. Then in the afternoon, we'll break into small groups and engage in legislative visits. That's why this form asks who your state assembly and Senate representatives are. We'll break up into groups based on geography and visits, and each group will have a schedule of a few offices to visit, armed with fact sheets, talking points, DXF-related materials. And thanks to the California Healthcare Foundation, we'll have a space for folks to stop by and have lunch. Those of you who may have joined briefings and other Capitol events pre-COVID may have remembered that we could have boxed lunches and whatnot in the hearing rooms. They're very strict about no food there anymore. So we'll just hop across the street to the CHCF building for those lunches during breaks in the afternoon session. So I'll pause and see if there are any questions about the day, but please do RSVP if you're able to make it in person. If you have any other questions about how the day will look or any other logistics, please feel free to send us an email and we'd be happy to talk more. Are there any questions?
Stephanie, I can say, I think Dr. Wood has agreed to help us kick off the event, correct?
Yes, Dr.
Like
Wood will
breaking
join
news.
our briefing.
Hi, Felix.
Did you put the link in the chat? Yes, you did. Thank you.
Yeah,
And I
Felix.
think in the registration, we asked for zip code, right? So that we can match with your representatives. We need you to do this now so that we can pre-plan the meetings with the members. Felix?
Yes, thank you. And also, Timmy, thank you for that late breaking update that Assemblymember Wood is going to kick off this, very exciting event, which, again, kudos to all of you for putting this together. I think that's a good kind of segue because, the Assembly member is the author of AB 1331, pending legislation, whose status is still uncertain, but obviously very, critical to I think the movement and many of the goals of the coalition. So yeah, I think it's very fitting to have him obviously headline the event to start off with. I think that also brings to the fore what type of focus should be front and center for the actual education session and also the legislative briefings. I mean, it's one thing to obviously, it's a very important thing to give staff, just a 101 in context about what the DXF is. But in terms of getting to the ask, what do we want to actually, request of these legislators and their staff when we meet with them in small groups. I'm assuming there's going to be some programming of just what the talking points are,
Yes.
how to basically urge their support for AB 1331, et cetera. So yeah, I assume that's all kind of part of the planning, but I just wanted to see whether there's an opportunity to help develop that behind the scenes as we lead up into the actual event. That includes also the materials, if there are gonna be flyers and leave behinds, because that can also obviously be very helpful to the audience.
Absolutely. Stephanie, do you want to go through the objectives? Yes. And we have some time to be able to refine that with this group here, but I'll hand back to Stephanie.
Yeah, no, I completely agree. And yes, Felix, welcome the help. And we'll spend some time at our next meeting in 2 weeks going through what some of those talking points are. And we continue to await updates right on 1331 and can refine our talking points for offices based on any news that happens between now and March 7th related to the bill.
Okay, next slide. State updates. Stephanie, I think you still have this.
Yeah, quickly going
Sorry,
through some.
Guys,
Oh,
just a quick question. I was trying to come off mute. I apologize. Just are you only looking at state representatives? Do you have an interest in others in government, whether federal or executive branch, et cetera, who touch on these parts of our world?
yeah, for the Sacramento Day, we're looking at the governor's office as well. In terms of federal meetings, I think that would be a different event. We're talking with Civitas about their, upcoming DC Day. But yes, definitely interested in hearing ideas on more government officials to meet with.
Well,
And we've
I think,
also-
for example,
Connecting.
they might have I mean, their offices, for a lot of the folks may have offices or, I don't know if there's anyone, I'll have to look at where they are, but to the degree that you have federal folks who may be representing a region in Sacramento or encompassing Sacramento, they may care. And obviously, again, my bent being things like emergency services and patient identity and things. But for example, there's offices focused on roadway safety and whatnot that are pretty important, pretty under the microscope right now. I think now would be a great time to be able to say what type of innovation can be brought to them, since they've got a lot of focus on roadway injury and death in California. So I wouldn't leave that aside. It might not be the focus for everybody, but it's a pretty active area. And obviously a lot of people in California use roads. So just one example off the top of my head. That's separate from emergency medical services. I know Leslie's here, and separate from fire, although that's there too. So there's a lot of parts of this ecosystem that are all siloed in California. But they're certainly there. The California Office of Emergency Services, extremely powerful organization that encompasses all of this, and it happens to share an office with Sacramento Metro Fire Department. So I would think there are a lot of places we could brainstorm on others that are part of this ecosystem one way or another.
So Jonathan, if you could take a moment and respond to the
Yep.
RSVP, and
I
in
did.
that, okay. And then
Yep.
what we'll do is come up with our visit agenda and share that with everybody, and are welcome to feedback. I just
Copy.
also wanted to say that Lisa Bari has accepted our invitation to also join us in the panel. So we'll have some federal perspective too. She's from Civitas. So to be able to kind of put our work in the context of what's going on at the federal level for interoperability. More to come as we'll announce our panel. Okay, go for it. Stephanie, if you want to run
Okay.
this through.
Yeah, I'll go through this really quickly just because we have a few more things on our agenda before 12. But just to mention bills that we're tracking, next Friday, the 16th, is the bill introduction deadline. So after the 16th, we'll have our full and complete list of bills for this year. Of these 5 here, just this bottom one, SB 957 from Senator Wiener's office, is a new bill since the last time that we met. These other 4 are 2-year bills that were introduced last year. And this bill looks at the Department of Public Health requirements around collecting SOGI data. So we'll reach out to Senator Wiener's office on that. I see a question in the chat around AB 1331, a 2-year bill. Yes, so AB 1331 made it to the second house last year, meaning that it has until this summer to continue to continue moving. And this is the second year of a 2-year session. So those bills would need to be decided this year, 2024. If we go to the next slide, another piece of tracking that we have here are new artificial intelligence bills. So there's been a lot of activity in the state legislature around AI bills. I would not be surprised if this list is twice as long by next Friday, because we've already heard of some other ones that will potentially be introduced between now and the 16th. But really want to bring this to you all. One, we'll continue to just keep adding to this list as AI bills become introduced, but really interested to hear if any of these are of highest priority or are making their way to your desks or your organizations. Of these, only Assembly Bill 2058 from Weber's office specifically mentions AI in connection with healthcare. The others are much more general, blanket AI disclosure, transparency bills. But potentially have huge ramifications for healthcare. So we want to continue engaging in these and really look to all of you, particularly those who are following the AI space really closely, to share with us as these bills continue to evolve and get amended, which may be of highest priority for this group. And I think with that, I'll hand it back to Olivia to finish us off.
Perfect. And yes, let's finish off the session with just a few quick DXF updates. There haven't been any new PMPs since we last met. I think CDII got through a ton of them at the end of last year and at the beginning of this year. So nothing on our radar for right now of new PMPs that we expect to come out. But we did want to flag that the California Information Blocking PMP is currently undergoing administrative modification to be in alignment with ONC's HTI-1 final rule that was recently announced. So the deadline to give feedback is February 19th, I believe. And there's a web-based form that you can fill out if you have any objections. And we did also want to flag for people, just in case you missed it, that the glossary of defined terms has been updated to reflect some new definitions in the more recent PMPs that have been released. And we did also want to call out and celebrate that there have been some new DSA signatories since we last met, which notably include some of the UCs. So UC Davis Health is now on the list, as well as UCLA Health. Timmy, do you have anything you want to add there?
I just think kudos to everybody for our work and for being able to, get through this. This is a milestone of seeing the UCs jumping on. So we'll continue to add as others sign, but really it's the power of this community. Thank you.
I would just, this is John Helvey from Sac Valley MedShare. I'd also like to make sure everybody know that Lucille Packard and Stanford have also signed.
Oh, fantastic.
Exciting.
Thank you. Super, super.
Yeah, we look
Love it.
forward to keeping up the momentum. All right, moving forward. Also want to just keep people updated that there are some upcoming committee meetings. I haven't seen the PMP subcommittee meeting officially make it to the website, but it did come through in an email. So it looks like that group will be reconvening virtually on March 6th. And then we have the IAC meeting, which will be hybrid later in the month on March 19th. And we also wanted to flag for the group that there have been a couple new resources that have dropped, including the QHIOs at a glance, which I'll show on our next slide. CDII has also released some updated FAQs, so make sure you're referring to the one that's dropped in January, not the one from, gosh, I believe, actually not sure when, but the previous one was from 2023, so let's make sure we're using the January 2024 version moving forward. And along with the participant directory going live, there's also a how-to guide. So would recommend people refer to that on how to update their preferences. And here we're very excited to see that CDII has released the QHIO at a glance resource. It's pretty short and sweet, which is great. I think this will be a great tool for participants to help assess, which QHIO meets their needs and is connected with their partners. It includes information on geographically where these QHIOs are operating. Additionally, what types of organizations that they serve and the type of data that you can exchange through it. So it's a really useful, concise tool, and we'll be sharing it out amongst our networks, and we encourage all of our partners to do the same. Also, we wanted to highlight that the DXF participant directory is dropped. It is both an application, which I believe is now accessible, and it will also be a list that we can expect to see released, I believe, weekly, and it will be available publicly on the CDII website. At this time, participants, which includes QHIOs and other intermediaries, are able to go through and indicate their primary choice for the 3 different types of exchange. Their choice for requesting information, their choice for delivering information, and also for those who it applies to, their choice for how to receive requests for ADT notifications. Unfortunately, we don't have too much time to dig into this, but Connecting for Better Health is really interested in understanding how participants intend to use the participant directory. It will be a great resource for people to reference and understand how their partners are exchanging data. But we'd like to keep the conversation going about, what other uses it could have and other developments that, could be made to this tool to make it more useful for our partners. So, definitely send us an email or get in touch with us, and we're collecting this feedback to report back and highlight to the state. Oh, and it's also worth mentioning.
It is also centered in the Sandbox, so we'll be able to really test it in its true utility there too. Go ahead, Olivia.
Yeah, perfect. Yeah, and we also want to flag too that the requirement right now is for participants, now that it is available, to enter their choices in by February 14th, so they can be on the first refresh or the first release of information. There was a webinar yesterday that actually did a walkthrough demo, which we won't have time to look at today, but RIM did a great job walking us through how you can select your choices, how you can enter data. If you choose self and are going with a point-to-point connection, you can insert information about who to reach out to develop that connection. You can add a URL to help establish this point-to-point connection. And CDII did a great job of building out this tool to, not only include the choice of how you would like to exchange information, but how to actually begin setting up that connection. And they will be posting the webinar recording, so keep an eye out for that. And in our last 2 minutes, I'll just quick wrap up with a couple pieces of news, events, and announcements. Connecting for Better Health will be at Vive in less than a couple weeks from now. And Blue Shield Industry Initiatives and Health Tech for Medicaid is hosting a happy hour that they would love to see all of you at. We can include the RSVP in the chat, but they are having this happy hour and want to have our Connecting for Better partners here. So we'll keep pushing this out. As always, please subscribe to our newsletter. We are doing a great job of tracking both DXF updates and also federal updates that impact our work, and just other, data exchange related news. And finally, some upcoming events. ONC is having an info session on the HTI-1 rule right after this, right after our Connecting for Better Health meeting. And they've had, I believe, 4 sessions before this one, and all of the slides and recordings are available online. We're also going to be, also wanted to highlight that Stanford is doing an event on TEFCA next week. We have Vive coming up, we have HIMSS coming up, Northern California State of Reform is coming up. And we're also very excited about Riverside County Medical Association's first annual AI Healthcare Conference. So we're hoping to be there. And also California Medical Association is having a Health IT Summit in San Francisco later this year. So if you have events, webinars coming up, please let us know. We'll make sure to add it to our tracker. And I believe we're right at time. So let me turn it over to Timmy to close us out.
Woo! That was a lot. Thank you, team, for being able to have all this amazing relaying of information to everyone. As always, we're available. We'll see you in 2 weeks, and can't wait to see you in person in March, and actually at Vive too in April. So, or am I right with that? Is it in April, or did we? February. I'm trying to remember which events are which. We will see you at Vive soon in person, and then also in March at the Capitol. So thank you. Have a great day, everyone. And thank you, Evelyn, for the presentation.